Why does ear pain cause muffled hearing? Imagine your ear as a finely tuned system designed to send clear sound signals to your brain. When you experience ear pain, it often feels like your hearing is muffled or blocked. This is because the same issues causing the pain are also interfering with how sound travels through your ear. The ear has three main parts: the outer ear, middle ear, and inner ear. Sound waves travel through the outer ear to reach the eardrum, which vibrates and passes these vibrations to tiny bones in the middle ear. These bones then send the vibrations to the inner ear, where they are turned into electrical signals for your brain to interpret. When any part of this system is affected by pain-causing conditions, your hearing can become less clear or muffled. One common reason for ear pain and muffled hearing is a middle ear infection, known as otitis media. This infection causes inflammation and fluid buildup behind the eardrum. The fluid acts like a barrier, preventing the eardrum and the tiny bones called ossicles from moving freely. This movement is essential for transmitting sound properly. When the ossicles can't vibrate normally, sounds become muffled or less distinct. The pressure from the fluid and swelling also causes pain, which often coincides with a feeling of fullness in the ear. Once the infection resolves and the fluid drains out, hearing usually improves. However, repeated infections can sometimes damage the ear structures, leading to longer-term hearing issues. Another key factor is Eustachian tube dysfunction. The Eustachian tube connects the middle ear to the back of the throat and helps equalize pressure inside the ear. When this tube becomes blocked, often due to colds, allergies, or sinus infections, it can't do its job properly. This causes negative pressure and fluid to build up in the middle ear, leading to ear pain, a sensation of fullness, and muffled hearing. The eardrum may be pulled inward because of the pressure difference, making sound transmission less effective. Excessive earwax buildup can also cause muffled hearing and discomfort. When too much wax accumulates, it can block the ear canal, preventing sound waves from reaching the eardrum. This physical blockage can cause a sensation of fullness, ear pain, and muffled hearing. Removing the excess wax safely often restores normal hearing. Other causes include ear injuries or trauma, which can damage the eardrum or middle ear bones, leading to pain and hearing problems. Sudden pressure changes during flying or diving, known as barotrauma, can also cause pain and muffled hearing by disrupting the normal pressure balance in the ear. Rarely, inner ear conditions like Meniere's disease involve fluid imbalances that produce ear pain, muffled hearing, dizziness, and ringing in the ears. In summary, ear pain and muffled hearing are closely linked because the conditions that cause pain, such as infections, fluid buildup, or blockages, disrupt how sound travels through the ear. Protecting ear health by avoiding inserting objects into the ear, treating infections promptly, and managing allergies or colds can help prevent these issues. If ear pain and muffled hearing persist or worsen, it is important to see a healthcare professional, such as an ear, nose, and throat specialist, for proper diagnosis and treatment. Remember, everyone's ear health is unique, so personalized medical advice is always the best course of action.